Until now, a uniform labeling system that would permit consumers to compare absorbency between different tampon brands did not exist. So, the Super Plus label on this brand and the Super Plus label on this brand did not necessarily mean the same thing. That's changing.
The new labeling that will appear on the tampon box should look something like seen in this chart. There'll be some information about the ranges of absorbency corresponding to each term, so that if a woman picks up a box that is labeled Super on the outside, she'll be able to look on the back and determine that that product absorbs between 9 and 12 grams.
Experts say it's that information, the amount of liquid absorbed by tampons, that women must have in order to reduce their risk of toxic shock. To determine absorbency, all tampon manufacturers will use one standard test, as designed by the FDA. The resulting absorbency range will appear on all tampon boxes. It's hoped the new information will help women select tampons with the lowest absorbency needed to control menstrual flow.
We would recommend that women attempt to use a lower absorbency tampon, particularly during the course of her menstrual periods. Her needs might change. She should also consider alternating the use of tampons and pads. That would also reduce her risk of TSS.
While the incidence of toxic shock is hard to pinpoint, it is said that between 1 and 17 cases out of 100,000 menstruating women are reported yearly. The highest number are among teenage girls between the ages of 15 and 19. Still, all women who use tampons are urged to take precautions.
TSS is a rare disease, and simply because someone has not had any problems with it to date does not mean that she might not be at risk for TSS.
To further safeguard against toxic shock, women should recognize the symptoms. They include sudden high fever, vomiting, diarrhea, fainting or near fainting when standing up, dizziness, and a rash that looks like a sunburn. A woman who suspects she is suffering from toxic shock should remove her tampon and see a doctor immediately. Prompt action is crucial. I'm Tom Jenkins reporting.